the top again. I want to, first of all, thank you all for coming. And I wanted to get together for a roundtable to discuss the upcoming session. But the first item of business is that my original plan was to head back to Washington tonight. Swearing is tomorrow. But I learned just yesterday that the Republicans intend to have as their first action the repeal of health care. And they're going to be having a hearing in the Rules Committee, on which I served in my first term, on Thursday to take up a rule that would then be brought to the floor next week for a vote on repealing health care. This is very alarming because the health care bill, however controversial, contains provisions in it that go to the heart of protecting the middle class. And the rhetoric on health care is now confronting the reality of what it means to repeal some provisions that are absolutely essential to middle class security. And I intend to return to Washington. I am returning to Washington early in order to mobilize support among my Democratic colleagues to protect provisions in health care that are very important to the middle class. And let me be specific. Under the health care bill, right now, families can keep their kids on their insurance policy until those kids are 26. That's incredibly important because many of our kids getting out of high school, getting out of college, their entry-level jobs don't come with health care. This gives them a shot at getting a job where they can also have the security of health care, and it's enormously important to our parents. Second, you cannot be denied health care if you have a pre-existing condition. That's going to be repealed. So it means if you're a person with cancer, if you're a person with diabetes, you apply for health care, the insurance companies are going to be able to do now as they did before, and that is to deny you coverage. Third, seniors have finally gotten the right to have free preventive care. That is going to be taken away under the Republican repeal. Fourth, folks with chronic conditions under health care reform don't have lifetime limits on the coverage available to them. They have a lifetime condition, they need lifetime care. That will be repealed. So there's four very essential provisions that make a big difference to middle-class families. The age 26 coverage, the pre-existing condition, the free preventive care for seniors, the lifetime limits. Those will all be repealed. I've circulated a letter among my colleagues proposing amendments that would protect these specific provisions. We already have over 20 co-sponsors, and I'm returning to Washington early so I can be at the caucus to speak about health care and to develop a plan that will do the level best to protect these important middle class benefits. Now, whether we win or lose is not we'll see. But what we have to do is require all of us in Congress, red state, blue state, to be accountable for this vote. This is not a symbolic vote when it comes to this question of repealing health care. It's about taking away hard-fought benefits that go to the heart of middle-class security. And this Congress has to be about protecting and expanding the middle class. And if the first action of this Congress is to take away hard-fought middle-class gains, that's a huge mistake, and I'm going to do all I can to resist it. Now in Washington, with this new Congress, we've got a Republican majority. And elections have consequences. There is a majority that is going to, that reflects the will of the American people. I'm going to work with them whenever I can. The question of fiscal responsibility, of building jobs in this economy, of having health care security, of having an energy policy that creates jobs and cleans the environment, that's not a red state, blue state concern. That's something that is absolutely important to the future of this country. So my goal, when I'm working on things like Homestar, where I had bipartisan support last session, I'm going to work with Republicans. I'm going to go seek out to find what their concerns are and find out how we can accomplish things together. So when we can work together, I will. But when we have to resist, I will do that as well. Healthcare is an example where it would be absolutely harmful to the middle class to take away these hard-fought benefits. It's one thing to talk about improvement, and all of us, I think, should be ready, willing, and able to improve legislation. It's quite another to talk about repeal when that is going to do real harm to middle-class families in Vermont and around the country. So on this topic of health care, incidentally, some of the best provisions of the health care law just went into effect this January 1st, and the Republican plan will be to repeal those immediately. For instance, seniors right now, as of January 1, when they're in that donut hole on their prescription drugs, get help. So the cost of that is mitigated. They save some money. The Republican repeal would take that away. Seniors get free preventive care. That'll be taken away. And also, the first time we've had some control on insurance company profits, making them spend the premiums you and I pay on health care rather than fat CEO salaries. The medical loss ratio, requiring insurance companies to spend at least 80% of the premium dollar on your health care and mine, that'll be taken away as well, leading to vastly higher profits and lower services for seniors. So these issues are very consequential, and my view, whether Republicans or Democrats are in control, we've got to be focused on rebuilding the middle class, revitalizing the middle class. And my approach in Congress will be to call it as I see it, to work with Republicans when I can, when the policies we pursue are fair and balanced when it comes to restoring fiscal stability, that they're sensible when it comes to creating jobs. So I'm going to do all I can to work with them, but we're going to see, because they'll be in charge and we'll have to react to the policies they propose. This first effort, repealing health care, with these specific provisions that benefit the middle class families, is wrong, and I'm going to resist that.